The kidneys are a pair of bean-shaped, dark red organs located on either side of the spinal column. Each kidney measures approximately 12 centimeters in length, 6 centimeters in width, and weighs approximately 150 grams. The kidneys perform various functions, such as regulating blood pressure, electrolyte concentration, and the volume of body fluids. One of the most important tasks of the kidneys is to help the body eliminate foreign and harmful substances, and they do this by filtering metabolic waste products from the blood and then excreting them in the urine. When the kidneys are not functioning properly, they can send us some signals, but these are often confused with other conditions. In other cases, however, kidney diseases do not manifest any symptoms until the very advanced stages. Let's look at some symptoms that could indicate kidney malfunction. Burning and frequent urination. If you feel the need to go to the bathroom more frequently and feel burning when urinating, you may be suffering from kidney stones. These are small pebbles called stones, which are formed inside the kidneys when the substances normally present in the urine become too concentrated and accumulate in the form of solid material. Thus, the first crystals are formed, which then aggregating with each other form the actual kidney stone. If they are very small, they often pass through the ureter, bladder, and urethra and be excreted in the urine painlessly. If the stones reach larger sizes, however, they get stuck in the kidney and you may feel a sudden and intense pain radiating from the side to the groin or thigh, and can also be associated with nausea and vomiting. We talk about renal colic, and it causes very painful pangs that are often described as a stab in the side and are caused by the peristaltic contractions of the ureter that tries in every way to expel the kidney stone. Blood in the urine. The color of the urine reveals us valuable information about our state of health. In the case of a healthy person, the urine is clear, straw yellow in color and does not emit a bad odor. If you notice the presence of blood in the urine, it is called hematuria and could indicate problems in the urinary tract from the kidneys to the urethra. Common causes include cystitis, bladder infection, prostatitis, prostate infection, or urinary tract stones. In severe cases, it can be the wake-up call for a more serious ailment, such as a tumor or kidney disease. It is important to always contact your doctor or urologist as soon as possible. In some cases, however, the urine has a reddish color, but not due to the presence of blood, but it can be the side effect of some drugs or after prolonged physical exercise. It can also occur after excessive consumption of certain foods, such as rhubarb, beets, and blueberries, but also due to contamination of the urine due to vaginal blood loss. Excessive accumulation of liquids. If you notice a generalized appearance of edema, i.e. accumulations of fluid accompanied by swelling, in some parts of the body, such as feet, ankles, and abdomen, but also in the face, it could indicate a pathology known as nephrotic syndrome. It is a disease characterized by an excessive loss of protein in the urine that can occur following damage to the kidneys. Other symptoms of nephrotic syndrome are foamy urine due to the presence of proteins in the urine in excess of normal quantities, and wheezing due to the accumulation of fluid in the space surrounding the lungs. Kidney failure. When your kidneys are no longer functioning as they should, it is known as kidney failure, and it is a serious medical condition, which if not recognized and treated in time can be fatal. Waste substances tend to accumulate in the blood, causing a state of intoxication and imbalance that can cause other major health problems. In the early stages of chronic renal failure, there are usually no obvious symptoms because the body is still able to compensate for the loss of kidney function. When the disease reaches an advanced stage, you may experience some symptoms, such as constant fatigue and low energy that cause difficulty concentrating and fatigue in carrying out normal daily activities. Sleep disturbances, but also itchy and dry skin. Reduced kidney function hinders the production of sebum by the skin glands, also causing constant itching. Other symptoms are muscle cramps. Kidney failure causes electrolyte imbalance, and therefore low levels of calcium, sodium, potassium, and phosphorus, disrupting the proper functioning of muscles and nerves.